Whitman, you speak to a lot of customers on a weekly basis, and I imagine call volume is one of those challenges that comes up again and again. Is this a universal problem?
Yeah, inbound call volumes is definitely something I've heard a lot when I'm speaking with customers. And on top of that, we're also seeing a pretty high call abandonment rate because there are only just so many people who can answer calls. And I speak to customers where sometimes the call abandonment rate can be up to 15%
Oh,
and can be
wow.
very off-putting as someone who's trying to call in and they're not able to get the help they need without needing to wait a long time.
So I imagine if they're waiting and if they hang up and abandon the call, there's implications for both staff and on the patient care side too, right?
Yeah, for sure. Because all this request that a patient is asking for is because they are looking for something related to their care. And the work for both the patient and the staff is very hard. And what makes me really feel for this problem is that a lot of these requests that are coming in are actually workflows that have been automated elsewhere.
Well, that's really interesting. So if it's automated elsewhere, like how are we solving for this additional call abandonment that's happening on top of that?
Yeah, so the thing that's really powerful with Navigator, our conversational AI agent, is that this time we are really trying to meet the patient where they are at the same time also leveraging a lot of the configurability that we already offer to health systems today through our products like scheduling and appointment reminders that we really spend many, many years really getting to do and perfect it really well.
So are you saying that Navigator can essentially inherit all of the learnings from like our scheduling product, our forms product, whatever it may be, and it can apply that through the voice product?
Yeah, so right now, Luma has a really deep experience with a lot of EHR integration, which means that we know how to get the information we need from your EHR, say Epic, Athena, Oracle Cerner, Meditech, or ECW. And then on top of that, our decades of experience working with thousands of customers to automate workflows that achieve desired outcomes. Navigator is sort of an extension of that Luma experience to meet your patient where they are at so that we can also automate the workflows from there.
So I imagine that's pretty significant with 10 years of experience in doing scheduling and all of these other things. Can you show me a little bit in the product what that looks like?
Yeah, for sure. So let me actually walk you through our mission control, which is where users would typically be configuring the workflow that best suit their practice needs. So over here, you have mission control. And under feature settings, there are many, many options depending on the products that we have today that allows you to configure the best workflow that fits your needs. So let me just go into reminders right here. And just by scrolling down this page, which is just a subset of what we can really configure for your practice, when it comes to scheduling or intake form, our form builder is really, really robust. So let me just show you an example of a PS Plus form. Like if I click on the question type, there are many different question types that we support, as well as being able to support jump logic, as well as a number of filtering. So all this configurability that we have today as part of our platform will just be extended to Navigator as it also supports you with things like appointment management or scheduling.
Very cool. So not only do they get, the benefits of all of our other products that we have, but then they can customize to their workflows and how they see fit.
Correct. So if you're an existing customer with us and all those is really configured, Navigator is just really pretty much a quick turn on for your staff because we already know all the setup and Navigator is just extending that process of being able to automate where patients are asking of those same requests just via a different channel.
Very cool. Well, thanks, Women. That was really helpful.
No problem.